Good morning, students. Today I will say about the anatomical structure, introduction to anatomy. Okay. The definition and scope of anatomy. What is the definition of anatomy? The study of structure and forms of the human body. Study of the structure and forms of the human body. That is the definition of anatomy. The subdivision of anatomy, what is that? The grass anatomy. My grass anatomy is that entirely the structures of the diagrammatic representation of the features. That is the grass anatomy. The microscope anatomy, what is the microscope anatomy? The structure is study is through the microscopic level of the structure. That is a microscopic anatomy. What is the developmental anatomy? Developmental for the fetal life to the adult life, how to develop the body parts, the structures. That is a study about this developmental surface. That what is the upper anatomy? This upper anatomy is the abnormal pathology is mainly done at the this undergone for this criteria for anatomy. Anatomical position on planes. Anatomical position, standing erect position, mainly for erect position, mainly for the nose pointing forward. Then the chest should be erect position. Both abdomen should be equal level. Then it should be pelvis should be neutral position. The patella should be for anterior position. Then toes should be pointing forward. That is the anatomical position of the. Then arms should be facing forwards. That is the anatomical position of the human body. Then the plane, what three planes occurs in the plane: sagittal plane, coronal plane, and transverse plane. The sagittal plane mainly occurs in the vertical axis along to the head to toe. The body shifted divided into two parts: right off and left off. This plane movements occurs only in the flexion and extension movement happen. Then is mainly movements occur at the flexion extension movement. Okay, then in coronal plane, the body acts as the anteroposterior axis passing through the body. Body split into the anterior part and posterior part, anterior segment and posterior segment. Then this plane movement happen in the abduction and adduction movement happen this frontal plane. Then third one is the transverse plane. The transverse plane along with the transverse axis, the constitution of the either upper half and lower half. This kind of the plane, the movement occurs at the rotational movement is happen this transverse plane. Then used as a reference movement of the structure of these planes. Okay. Then subdivisions of the anatomy, seen about the interest of the anatomy, microscopic structure of the anatomy, then gross anatomy, then muscular and lower structure of the anatomy, then interest of the physiotherapy. Then I either divided into the interest of anatomy mainly for definition and scope, anatomical position, and planes and axis. Okay. Then either of the definition and scope mainly for study of system and forms and subdivisions. The subdivisions mainly either into 5 types: that were gross anatomy, microscopic anatomy, developmental anatomy, surface anatomy, and upper anatomy. Then anatomical position is nothing. The axis of the movement, the planes occurs at the planes mainly for the sagittal plane mainly occurs in the two movement, that is the flexion and extension. Then the frontal plane occurs in the two movement, abduction and adduction. Then transverse plane movements occur in the three movements: on the middle rotation, lateral rotation, and circumduction. These are the movement occurs in the three planes. The movement is synchronized to the body movement. Okay, these are the structures mainly pass through this structure. Study about the combined human body structure. Study about this class. Then is mainly for the human body. What are the parts present in the structure? Head to toe. Mainly for the head facing the head cranial section. The cranial section mainly for head skull enveloped over the skull is enclosed by the brain. Okay, brain structure. Then front of the head is mainly for facial structure. The facial structure mainly for the forehead, eyes, nose, and the mouth. These are the structures are present in the facial structure. Then next we will go for appendicular skeleton and axial skeleton. The axial skeleton mainly for the center of the body is meant for axial skeleton. Mainly for the thorax region, the thorax, heart, lungs organ. Then these are structures that occurs at the appendicular region. Then we will go for appendicular region, appendicular system mainly for either side of the peripheral joint, mainly for upper extremity and lower extremity. Then that is the appendicular skeleton. So the appendicular skeleton mainly for several bones occurs in the joint. That is the humerus, scapula, clavicle, radius, ulna, carpal bones, metacarpal bones, phalangeal bones occurs in the skeleton. So either way, simultaneously lower limb will go for hip bone, pelvis bone, femur, patella, tibia, fibula, then tarsal bones and metatarsal bones. These are bone present in the entire appendicular skeleton. Oh, this appendicular skeleton is normally present in the human body. This is normal look in the body. Normal weight bearing position is making in the human body. That is okay. The axial skeleton is mainly for entire the rib cage movement, the circulation of the heart and lungs to covered by this rib cage movement. These structures involvement of the protection of the internal structure of the lungs and heart. Okay. Okay, this is study about the anatomical structure of this class. Okay, thank you.